Hello, I'm Melanie Griffith, President and CEO of the Maryland Hospital Association. We're proud to partner with the Daily Record on this event to honor your incredible contributions, and we're grateful to them for shining a spotlight on the heroes who make healthcare in Maryland so exceptional. Today we celebrate you, our healthcare heroes, and the extraordinary work you do every day in Maryland's hospitals and health systems. You are the heart of our hospitals and the strength of our communities. You show up with skill, compassion, and unwavering dedication, 24/7, 365. You lift up patients and families during their most vulnerable moments, and you inspire all of us with your courage and commitment. Thank you for the hope you bring, the lives you touch, and the difference you make every single day. You are true heroes, and today and every day we celebrate you. Let me again say congratulations on behalf of all of us here at the Maryland Hospital Association.
We want to thank our sponsors, event partner Maryland Hospital Association, supporting sponsor Kaiser Permanente, Mount Washington Pediatric Hospital, University of Maryland Medical System, and our celebration sponsors, LifeBridge Health and Roland Park Place. Let's meet our Lifetime Achievement heroes. Dr. J. Michael Brooks has devoted his career to advancing healthcare excellence and improving the well-being of Calvert County residents. For 35 years, he has been a trusted primary care physician at Calvert Health Medical Group. Beyond the clinic, he has served in numerous leadership roles, including chairman of the Department of Family Medicine, a board member, and a key contributor to the Medical Executive Committee. Recently retired, he says his greatest reward is the gratitude of his patients. Congratulations, Michael. One of the region's leading interventional cardiologists, Dr. Paul Goebel, has made numerous groundbreaking research discoveries that have transformed cardiac medicine. Director of Cardiovascular Research at Sinai Center for Thrombosis Research and Drug Development, he has established new testing and treatment methodologies, including new prescription drugs for people at risk of cardiac events. He has shared his revolutionary findings at symposiums all over the world. Congratulations, Paul. A leader in the pharmacy field, Dr. Dawn Jacobs is Vice President of Pharmacy Operations at Baltimore Medical System. She has developed and grown the program to become the largest community health pharmacy program in the state. Thanks to her innovation, perseverance, and compassion, thousands of patients in the Baltimore region have better access to affordable medication and high-quality pharmaceutical services. This is particularly significant for uninsured or underinsured residents. Congratulations, Dawn. For 35 years, Dr. Sherry Perkins has improved the health of individuals and communities. A bedside nurse, then chief nursing officer, Sherry retires this year as president of Luminous Health Anne Arundel Medical Center. She led the hospital through the pandemic and guided its growth, expanding emergency care, surgical programs, and obstetrics, and developing new services for elderly care, open heart surgery, and mental health. She also established the Patient Family Advisory Council. Congratulations, Sherry, and congratulations to all our Lifetime Achievement heroes.
There was no one specific life experience. When I was 5 years old, I was in the office of my family doctor, and he commented to me at that time that you should become a family doctor and come to work with me when you grow up. So from the time I was 5 years old, I told everyone who asked me about my future plans that I was going to be a family doctor, and continued that dream as I went through college and medical school and residency. And I'm very happy to say that I still love being a family physician.
My most significant accomplishment has been in education, accomplishing an education and a training program that has led me to be what I would say a very competent physician. And he given me the ability to care for patients, an education that's allowed me to understand the importance of investigation. I was blessed to be trained at some of the finest institutions in the country in both clinical medicine and in research. So I would say my accomplishment has been to get through the rigorous education, training, it's given me the ability to help humanity.
Looking across a career of many decades, there have certainly been challenges that were chronic and challenges that were acute. And I don't know if now we can call the challenge of COVID acute or chronic, but I would say that it was for sure the biggest challenge of my career. And so here, 5 years later, to think about the vulnerability of COVID, the unknown of COVID, what that meant to our care for the community, what it meant to the care of our teammates, and the uncertainty that we had with having enough physical space, having enough equipment, having enough staffing, having the appropriate supplies. Again, delivering on our mission for the community and in partnership with all of our other healthcare partners external to the hospital was a lot to manage. To turn to how we handled it, very systematically. I have put a lot of stock across my career in emergency preparedness protocols and incident command. And so being very, very systematic about addressing what the need was and prioritizing that. But I'll tell you something that I've learned along the way about that is you need a plan, but you also need empathy. And that a plan without empathy is pretty empty. But also empathy without a plan is not very productive. And I would say that's how I think about these last 5 years.
Advancements and innovation in healthcare. Calvert Health's Center for Digestive Diseases and Weight Management is transforming lives. By integrating gastroenterology, metabolic, and bariatric surgery and a non-surgical weight management program under one umbrella, the center provides a seamless continuum of healthcare for patients with complex health needs. This innovative approach improves access, enhances outcomes, and positions Calvert Health as a regional leader in digestive and weight management services. Congratulations, Calvert Health. Kaiser Permanente Center for Healthy Weight and Lifestyle Medicine uses evidence-based and experience-driven programs and strategies to help patients improve their health through weight loss, reversing, and controlling chronic diseases and potentially decreasing medication use. Recognizing that no one approach fits all, board-certified physicians work alongside expert lifestyle coaches and nutritionists to design non-surgical and surgical treatment plans for patients. Congratulations, Kaiser Permanente. LifeBridge Health is taking a public health approach to reducing gun violence. The multifaceted Stop the Iron Pipeline initiative brings awareness around the issue of illegal gun trafficking, particularly along the I-95 corridor. The campaign encourages people to advocate for policy changes. Maryland has among the highest rate of out-of-state illegal gun imports in the country, accounting for 2/3 of all gun crimes in the state. Congratulations, LifeBridge Health. MedStar Montgomery Medical Center is enhancing patient care and supporting nurses through 2 groundbreaking initiatives. Remote visual monitoring allows for continuous observation of high-risk patients, reducing falls and improving response times, while allowing nurses to focus on direct patient care. And interactive patient care provides a cutting-edge system for on-demand education, entertainment, and real-time communication with care teams, helping patients feel more informed and engaged in their treatment. Congratulations, MedStar Montgomery Medical Center. The University of Maryland Medical System NEST is a brand new remote fetal monitoring unit. This team provides 24/7 fetal heart rate surveillance of moms admitted to the 7 birthing hospitals in the system and provides partnership to the bedside teams. The 17 highly experienced NEST nurses on the team also have the benefits of cutting-edge AI technology to offer additional surveillance. NEST is the first remote fetal monitoring center of its kind of the East Coast. Congratulations to the University of Maryland Medical System. In the category of community outreach, we have 5 individual honorees. Burke Poland is director of the Student Health Center at Frostburg State University. Chrissy has created vaccination clinics, wellness screenings, and health workshops. She also secured a grant for a vending machine that provides free, over-the-counter medications and health supplies. Beyond campus, Chrissy partners with healthcare providers and county and state health agencies to provide students and underserved community members with health support. Congratulations, Chrissy. For more than 25 years, Maria Darby has been dedicated to creating opportunities for underserved populations, specifically within the healthcare industry. Chief Operating Officer at Dwyer Workforce Development, she is instrumental in creating career pathways for populations lacking opportunity and tackling the healthcare workforce shortage. Dwyer Workforce Development empowers individuals by providing them with CNA and GNA training and job placement support. Congratulations, Maria. Dedicated to expanding access to abortion care and contraception, Dr. Jessica Lee is director of the Ryan Residency Program and co-principal investigator of the MARCH program at the University of Maryland Medical Center. She leads a team dedicated to training healthcare professionals, particularly in underserved communities, to provide essential reproductive health services and abortion care. Jessica believes all women deserve access to and support for comprehensive reproductive care. Congratulations, Jessica. Known for her integrity and compassion, Terry White is a transitional nurse navigator with the Population Health Team at University of Maryland Charles Regional Medical Center. Terry meets daily with patients to provide education about chronic disease management and help them connect with community resources. She also participates in community health meetings at senior centers and teaches health education classes, such as Diabetes Management 101. Congratulations, Terry. We have 4 organizations being honored for their community outreach. Healthcare Access Maryland believes every Marylander should have an equal opportunity to be healthy. Outreach teams are in the community every day working to connect individuals and families to health insurance coverage. Then they work one-on-one to assist them in navigating the healthcare system to access timely vital health services, mental health treatment, and dental care. HCAM helps more than 60,000 Marylanders every year. Congratulations, Healthcare Access Maryland. Junior League Prince George's County plays a pivotal role in tackling some of the most pressing public health challenges. 25% of new HIV cases are reported in the county, and 45% of residents consider themselves food insecure. The SLK Annual Test for Turkey initiative addresses both of those issues. For 2 days around Thanksgiving every year, it hosts a free HIV testing event and distributes food items such as turkeys and fresh produce to everyone who participates. Congratulations, Junior League Prince George's County. Preventing the spread of RSV is the goal of the Flex Your Protection vaccination campaign. Maryland Department of Health partnered with MPT's Maryland State Ad Agency to create the campaign, which is expected to generate 114 million impressions this year. It is reaching both English and Spanish-speaking audiences using TV, radio, streaming audio, display, outdoor, and social media platforms. Congratulations, MPT's State Ad Agency and the Maryland Department of Health. Sheppard Pratt partnered with the Ravens to launch Mental Health Training Camp, dedicated to supporting the mental well-being of kids in sports. High school athletic directors, coaches, and trainers were invited to the Ravens practice facility to learn what to watch for and how to respond when issues arise. Also, by leveraging the Ravens platform, including signage at games, Sheppard Pratt reached tens of thousands, spreading crucial information about available mental health resources. Congratulations, Sheppard Pratt. Our first mental health hero is Dr. Scott Aronson, a pioneer in advancing the treatment of severe treatment-resistant mood disorders and research around the use of psychedelics to revolutionize psychiatric care. Chief Science Officer at the Institute for Advanced Diagnostics and Therapeutics, as well as a psychiatrist at the retreat at Sheppard Pratt. He played a pivotal role in making transcranial magnetic stimulation and vagus nerve stimulation available to people suffering with difficult-to-treat depressions. Congratulations, Scott! An internationally recognized pioneer of forensic interview techniques, Crimson Barocca aims to minimize secondary trauma for children and adults who are victims or witnesses to violence. Manager of Education and Research at the Jill Fox Center for Hope, she created an evidence-based forensic interview toolbox and a program that are not only helping survivors here in Baltimore, but also being used in countries as far away as Ghana and Mongolia. Congratulations, Crimson. Christina Darwin considers it a gift to walk alongside people doing the hard work to break free from addiction. Mental Health Program Manager for Ashley Addiction Treatment's newest program, Ashley Behavioral Health and Wellness, Christina has played a pivotal role in expanding access to high-quality mental health care for all Marylanders. A certified mental health first aid instructor, she is passionate about educating others on how to support those in crisis. Congratulations, Christina. For the past 35 years, Sarah Garner has served children and families affected by traumatic events, including violence, loss, and abuse. Director of Clinical Services at Kennedy Krieger Institute, Sarah leads teams focused on delivering excellent care while creating a positive and supportive workplace culture. One of her crowning achievements is developing a therapy model called Family Live, which is a caregiver-focused intervention for families affected by intergenerational trauma. Congratulations, Sarah. Dedicated to eradicating the stigma around mental health conditions, Carrie Graves has led NAMI Metropolitan Baltimore to double in size, both in revenue and the number of people it reaches with its free programming. Since becoming executive director in 2018, she has created strategies to reach Baltimore's least resourced areas, designed new youth-facing initiatives, and implemented a robust workplace mental health initiative to ensure employers understand the importance of a stigma-free workplace. Congratulations, Carrie. A devoted mental health leader within Kaiser Permanente and a psychiatrist working with children and adults in Maryland, Dr. Christina Lee has had a significant impact on patients. Regional Medical Director for Mental Health, she has worked tirelessly to expand and improve access between primary care and crisis care for therapy. She recently oversaw the expansion of specialty care services and the external provider network for psychotherapy. As a result, therapy visits increased 31% last year. Congratulations, Christina. Committed to mental health innovation and patient care, Dr. Jacob Schwartz is a psychiatrist and director of psychiatry education at MedStar Montgomery Medical Center. His work within the Well-Being in School Environments program and his leadership in the Adolescent Inpatient program demonstrate his dedication to early intervention and crisis stabilization. His enthusiasm for teaching shines through in his interactions with staff, patients, families, medical students, and community members. Congratulations, Jacob. The organizations being honored as mental health heroes begin with Baltimore Medical System. Its school-based mental and behavioral health program is transforming the mental and emotional well-being of young people through mentorship, education, and community healing. In its first year, more than 300 students from 4 schools are participating. Peer mentors meet weekly with staff to learn evidence-based strategies and build resilience. The program also engages families to learn about their child's mental health and development. Congratulations, Baltimore Medical System. K&I Healthcare Services is making a meaningful difference by providing comprehensive mental health and substances abuse treatment services to underserved populations. Services include therapy and counseling, a psychiatric rehab program, a substance use disorder program, and a supportive employment program. K&I has helped countless individuals struggling with their mental health regain independence and stability. Congratulations, K&I Healthcare Services. Let's meet our Nurse of the Year heroes. beginning with Dr. Lou Bartolo, President of the Maryland Nurses Association. An outstanding registered nurse and leader, he has made an unwavering commitment to advancing equity, inclusion, and excellence in healthcare for Maryland's patients and employees. He stepped up to address systemic issues within the healthcare system and implemented initiatives that will have a lasting impact on the workforce, ensuring that providers are better equipped to deliver fair and unbiased care to diverse patient populations. Congratulations, Lou. A critical care nurse at Luminous Health Doctors Community Hospital, Nebiat Habdagaber, has won the prestigious Daisy Award twice for the extraordinary care she provides. A preceptor, mentor, and charge nurse, she is respected as a clinical expert. In addition, she has stepped up as the clinical instructor for the first dedicated education unit for Doctors Community Hospital in conjunction with University of Maryland. Congratulations, Nebiat. For Chad Langford, nursing is not a career, it's a calling. For more than 20 years, he has cared for patients as an emergency department nurse at Calvert Health Medical Center. Always going above and beyond, Chad bought a car seat for a patient and rallied coworkers to donate other baby supplies when he realized a new mother did not have the essentials. Chair of the Calvert County Volunteer Fire and Rescue Association, his goal is to always provide care, comfort, and support to people in need. Congratulations, Chad. As a nurse at the Turk House Crisis Stabilization Center and Inpatient Detoxification Unit, Carolyn Mwangi not only provides compassionate care, but acts as a patient advocate. She works to provide safe, short, or long-term sobering services to adults in Baltimore City, regardless of their ability to pay. Since many patients live in poverty, experience homelessness, or lack access to routine medical care, Carolyn also provides resources to increase the success of their recovery. Congratulations, Carolyn. Clinical Programs Coordinator Shelley Stein has been a difference maker at University of Maryland Charles Regional Medical Center for 25 years. Her work with the Primary Stroke Program has made it a model for other hospitals. In addition, she is a dedicated and highly skilled sexual assault nurse examiner, and she oversees the Forensic Nurse Examiners Program. She believes nursing practice is not only about caring for patients, but working towards improving the overall health of Charles County. Congratulations, Shelley. For more than 20 years, Alma Tahassan has practiced nursing at Sinai Hospital. An expert clinician, Alma is a role model and mentor to other nurses. She recently developed and implemented a throughput nurse role that helps patients safely return home. An immigrant, Alma helps other international students find a sense of community, even hosting parties and helping them get their driver's licenses. Congratulations, Alma. And congratulations to all our Nurse of the Year heroes. Now let's meet the 5 heroes named Nurse Practitioner of the Year. Kimberly Davis is Director of Administration and Analytics for the Occupational Health Team at Northwest Hospital. Through data-driven analysis, she leads process improvements, including the first-ever operational plan for employee safety. Healthcare has more injuries than any other industry, including construction, and Kim is dedicated to keeping the team at Northwest as safe as she can. Congratulations, Kimberly. Dr. Ashley Fenton is founder and nurse practitioner at the Collective NP Clinic, which provides mental health and primary care services via telehealth. She carries her passion for integrated mental health and primary care into her role of assistant professor at Johns Hopkins School of Nursing. A licensed clinical social worker, she is also a dual certified family nurse practitioner and psychiatric nurse practitioner. Congratulations, Ashley. A nurse practitioner in the LifeBridge Health Heart Failure Clinic at Carroll Hospital Center, Jen Fisher has been instrumental in shaping and enhancing patient care within the state. The only heart failure clinic in Carroll County, Jen helps patients understand their diagnosis and how to manage heart failure at home. Through her collaborative efforts with local skilled nursing facilities, assisted living facilities, and home health agencies, Jen has been able to improve protocols to ensure a seamless continuum of care. Congratulations, Jen. CEO of NP On Call, Kelvinda Kamara specializes in both primary care and psychiatric services. By offering mobile services, she brings much-needed care directly to underserved communities. Understanding the growing need for holistic care, Kelvinda has established additional resources like the Community Closet and free cell phone program. She and her husband, Ike, also own K&I Healthcare Services. Congratulations, Kelvinda. Growing up in Nigeria, Agatha Yuka-Ebu saw firsthand the critical role healthcare workers play in times of crisis. Now nurse practitioner at Turek House's Integrated Behavioral Health and Urgent Care Center, Agatha provides quality health care to some of Baltimore's most vulnerable residents in need of therapy and treatment. She also engages the community, providing education on substance use disorder and treatment options. Congratulations, Agatha, and congratulations to all our Nurse Practitioner of the Year heroes. 10 amazing doctors are being honored as Physician of the Year heroes. A trailblazer at Mount Washington Pediatric Hospital for nearly 25 years, Dr. Ajoke Ujeyi Akintade serves as Interim Chief Medical Officer and Vice President of Medical Affairs. She improved the standard of care, helped to develop the feeding program, and organized the way the Pediatric Complex Care Program uses the trach pathway. She also expanded the behavioral clinic and developed the early detection team to identify infants at risk for cerebral palsy. Congratulations, Ajoke. An exceptional primary care physician, Dr. Kwame Akoto, has also helped tens of thousands of patients in Maryland get the care they need in compassionate and efficient ways. Assistant Physician in Chief at Kaiser Permanente, he's initiated a number of programs to improve care coordination between primary care and specialties. He's created a virtual coaching service and has been a champion for Dignified Journeys, training physicians on end-of-life conversations. Congratulations, Kwame. Medical Director for the Metabolic and Bariatric Surgery Unit at Calvert Health, Dr. Ramzi Alami, has led the development and expansion of the bariatric surgery and robotic surgery programs, offering patients life-changing opportunities. Recipient of the Outstanding Medical Leadership Award, he is deeply committed to mentoring surgical colleagues, ensuring that Calvert Health remains a leader in innovative and patient-centered surgical care. Congratulations, Ramzi. Owner of MediQuest, Dr. Marlene Mahipat is committed to restoring quality of life to her patients. After 21 years in practice, she went back to school to study medical cannabis in an effort to offer a more holistic option to her patients with opioid addiction. She is currently doing a diplomat program at American College of Addictionology and Compulsive Disorder. Founder of 2 nonprofits dedicated to human and animal welfare, she also volunteers 2 days a week with Meals on Wheels. Congratulations, Marlene. Unit-based Medical Director at Christiana Care Union Hospital, Dr. Batej Singh cares for vulnerable patients, often at the worst times of their lives. Many of his patients do not have access to health care or insurance, and often face other socioeconomic issues including homelessness, substance abuse, and mental health issues. In addition to providing expert emergency care, he also provides the resources to help them and their families after they leave the hospital. Congratulations, Baltej. Dr. Maurice Smith has revolutionized the way Frederick County residents receive their diagnosis and treatment of lung cancer, as well as their chest and thoracic surgical care. Medical Director of Frederick Health Medical Group Chest Surgery, he works with the community to provide early lung cancer screening. Vice President of the Born Vanguard Medical Society, he strives to advance the role of Black medical experts in the county. Congratulations, Maurice. An addiction health physician, Dr. Carolyn Tungang is Maryland State Medical Director of Recovery Centers of America, Capital Region, and Bracebridge Hall. She was instrumental in developing and expanding access to opioid treatment in the Maryland Department of Corrections and Baltimore Pretrial Complex. Adjunct faculty for addiction medicine at Johns Hopkins University School of Medicine, she also educates health systems, county agencies, and the public on overdose initiatives. Congratulations, Carolyn. CEO of Rome AI, Dr. Hisham Valiuddin is deeply committed to advancing patient care, improving healthcare systems, and ensuring equitable access to high-quality medical services. His career has spanned both frontline clinical practice and executive leadership, and his work has been instrumental in saving hospitals from bankruptcy. At Rome, his mission is to empower hospitals with cutting-edge generative AI technology that ultimately saves lives. Congratulations, Hisham. Called the gold standard for rounding on patients, Dr. Vincent Van Ott is a hospitalist at Northwest Hospital. He implemented changes in the multidisciplinary rounding technique, which equate to better patient outcomes and fewer readmissions. His experience as a family physician makes him super patient-focused, and he includes the patient and families as an active part of the care team. A repeat winner of the Superstar Award, Dr. V is also the go-to guy for orienting new doctors. Congratulations, Vincent. A board-certified dermatologist, Dr. Kate Viola sees almost 50 patients a day at Dermatology Partners. Beyond her clinical work, Kate volunteers on her days off to provide free skin cancer screenings for first responders and military veterans and their families. She also speaks to about 450 school children each year about sun safety. A trusted expert in dermatology, she is a frequent contributor to TV and publications, providing the public with essential knowledge about skin protection and sun safety. Congratulations, Kate. And congratulations to all our Physician of the Year heroes. We have 3 generous heroes in the category Volunteer of the Year. Peggy Alexander has been volunteering at Luminous Health Anne Arundel Medical Center for 11 years. She has logged more than 16,000 hours as a patient and family advisor for the emergency department. A retired Army nurse, Peggy is a member of the 5-person Executive Council and also is the coordinator of the Emergency Department Service Line, which consists of 40 volunteers. Congratulations, Peggy. Don't let her pink tutu fool you. Dawn Goldberg is serious when it comes to having fun. Known at Sinai Children's Hospital as the Tutu Tuesday Lady, Dawn sits bedside with some of the sickest children, playing cards, dressing Barbies, building Legos, and just listening to children talking about what's on their minds and in their hearts. A volunteer for more than 25 years, she also created the Dawn Goldberg Child Life Endowment to support the Creative Arts program. Congratulations, Dawn. At Luminous Health Doctors Community Medical Center, Valerie Nicholas has single-handedly acquired 55 pastoral volunteers of all denominations who serve the hospital and support staff. In addition, she serves as chaplain both in and outside the hospital, comforting patients and families during times of transition. Founder of the nonprofit Love Is Not Enough, Valerie serves people surviving domestic violence and homelessness, as well as advocating for individuals, families, and veterans. Congratulations, Valerie, and congratulations to all of our Volunteer of the Year heroes. The Workplace Wellness Program of the Year is Roland Park Place Associates Wellness Program. Wellness Wednesdays feature actionable health and wellness resources and tips. Additionally, there are monthly associate wellness break sessions, such as before work stretch, after work yoga and core, Zumba, and an after-lunch walking club. Financial wellness is a key piece of the wellness wheel, with on-site financial classes and access to associate, emergency, and scholarship funds. Congratulations, Roland Park Place, our Workplace Wellness Program of the Year. Thank you, and congratulations to all our 2025 healthcare heroes.